Good morning. It's so great to see you all here today. We're really excited about today's events. We have some great speakers who are joining us in a really informational presentation. So those of you joining us in the room, happy to have you here. Those of you online, thank you so much for hopping on. My name is Rebecca Andrade, and I'm the Educational Programs Manager here at the Kansas Health Institute. It is my pleasure to pass it over to Carrie Bruffett, our President and CEO, for some opening remarks.
Thank you. And welcome, everyone. Welcome, folks in the room and our many folks online as well who are joining us. So we're really looking forward to this conversation. Casey Sink, my colleague, who I'll introduce in the moment, will walk us through some of the work that KHI has done recently, just this year, focused on occupational health and safety. And wanted to give you some context for where this comes from. I think Casey will illuminate this even more as well. So this is certainly the first, at least at my time at the Kansas Health Institute, where we've talked about workplace safety as a public health issue or as a health issue. And the issue briefs that we'll be talking about some of the results from was born of interest in part because some of you folks are aware that America's Health Rankings, which ranks every state on a number of factors related to health, has a scoring factor or a measure that's related to occupational fatalities. And we saw that historically, Kansas tended to rank among the lower performing states with occupational fatalities, although that fluctuates from year to year and that changes. Lower performing is probably not the way to put it, right? But it has the most experience with some of those workplace fatalities. And we wondered, is it because of the industries, the kind of industries we have in Kansas, or what could we learn? So we looked at the data and we learned a lot, but we also realized that the data didn't really tell us what you can do as well. So really learning from folks and having an opportunity for us to learn, and we hope other folks in the health, public health field and in population health to think about how we potentially could partner with others who are very focused and dedicated on workplace safety. How could we meld some of the injury preventions and the thoughts the strategies that public health has with strategies in Department of Labor and with our friends that we'll be hearing from on a panel here shortly as well. So this may mean that some of you in the person or online aren't really familiar with KHI because this is the first time we've had this kind of event. So KHI, that's us. If you're in the building, you know this is the building you found. We've been around for 30 years. We're celebrating our 30th year this year. KHI is a nonpartisan educational and nonprofit educational organization. We're focused on health policy research and education. Our goal is to inform policymaking. And we define policymaking and policymakers pretty broadly. Policymakers aren't just the folks who show up in during the legislative session across the street. They're not just people who are elected to state office or local office, or even folks in state agencies. It's all of those. It's also everyone who wants to and can impact the policy process. And it also has policies that are at the employer level as well. We know that employers have policies that impact health and safety of the health of the population, health and safety of their employees. So we do define health broadly, we define policy broadly, and we define policymakers particularly broadly. We are committed to convening conversations that matter and that are meaningful conversations. And they can be tough topics sometimes, or they can be really engaging and fun topics. But it's important to have voices in the room that have direct experience with the policy issues or the underlying issues that we want to talk about. And we know that's not always going to be KHI. So we really thank everyone who's here, both to be on panels and to be able to ask questions in the chat or in the room that can help us learn more about this issue as well. Casey will walk us through some of the findings in the issue brief. Hopefully you may have seen that with the invitation to the event. There were links to that as well, but it will be a good level setter for the conversation today. And then we'll have a really great conversation with a group of panelists who are going to illuminate history and policy and opportunities around workplace safety in Kansas. So I'm excited for that and excited to learn more as well. We'll also have an opportunity for questions and answers. You have the opportunity in the chat, as Rebecca mentioned, or I think we have the Q&A function as well in Zoom as well, so you can submit a question through Q&A. So you can do that as we go, and when there's a good time to pause, we'll pause, but we'll also have some dedicated time for Q&A also. So with that, I want to turn it over to my colleague, Casey Sink. Casey is an analyst. She works primarily on data analysis, but she's has a broad interest in health and health policy. She has been with us. When did you start, Casey?
I think 2022.
Since 2022, and she's just remarkable. And she'll introduce another colleague, brought the idea of this analysis to us, and we were excited to be able to try something that we thought could help illuminate important issues, but also was a bit of a stretch for KHI. So thank you for giving us that opportunity. Casey, take it away.
Awesome. Thank you, Carrie. Like Carrie said, my name is Casey Sink. I'm an analyst here at KHI. I've been here for the last couple of years. I'm going to work through setting us through the stage, and then we're going to move to a panel discussion. But first, I want to acknowledge my co-authors on the issue brief that some of this data will be coming from. The first one is Emma Wittick. She's a former intern. She was an intern earlier this year at KHI. She is a master's and PhD student at Clemson University, and she's studying occupational health. And so she pitched this idea to us, and we really enjoyed digging into it with her, and she had a lot of expertise to contribute. So I really appreciate her help on all of this. And then Wenche Lin, who's in the room with us, our research director, also had a big contributing role. All right, so on the table, and there will also be a link in the chat, there's a resource guide. Some of the resources on there are resources from our speakers on the panel that you will hear from later, and then also some additional resources that are included in our brief. There's a section for notes if you want to take any, and also some discussion questions to just think through as we're moving through this. So now we're going to move into setting the stage, just kind of setting a baseline for those who may be new to this topic, and just making sure we're all kind of have a good understanding of the landscape right now of occupational health in Kansas. So thinking about what Carrie mentioned earlier, why is KHI talking about this? Why did we research this? And there's many connections to occupational health and public health, and that's really what we wanted to explore. And one of the big ones we looked into first was economic impact, whether it's loss of income to a community, to families when there's injuries or fatalities, or administrative burden or medical costs, the loss of wages and reduced productivity, which includes medical costs and administration costs in the US in 2023 amounted to $176 billion. And that doesn't account for additional burden on families and communities that I mentioned. The next one is connection to chronic health issues. If there's injuries or illnesses that somebody may face on the job, over time, those can compound into bigger issues and overall affect your life over time. The next one is preventable loss of life. The loss of life on the job is one too much. So thinking about how we can prevent those loss of lives and improve overall outcomes for all Kansans working. The last one is health disparities. You'll see towards the end of the population, we look into different industries, different demographics, and there are some disparities between different groups. So this kind of tells us that there's different ways we can approach each of those groups to solve and help close this gap. All right, so next we're going to go through a couple of definitions just to kind of level set. And these definitions are according to the Bureau of Labor Statistics, which is where we got our data. So according to them, an occupational fatality is any death resulting from an event in the workplace. So it has to be while somebody is in the job or in the work environment. And this includes illness-related deaths. So an example of this could be a heart attack while on the job. Next, looking at injuries and illnesses, an injury similar to a fatality is any wound or damage to the body resulting from an event at the work environment. And then the next one is illnesses. This could be respiratory conditions, poisoning, hearing loss. And this is based off of how it's recorded by the employer's judgment. So they fill out a survey. There's a census for this information. So COVID could be included in some of that data, but it's not clear that it always will, but sometimes it will be. All right, so looking at where does Kansas stand? How well are we doing? How do we compare to the rest of the nation and our neighbors? So in 2024, American Health Rankings placed Kansas in the top 20 states. And that's for the highest fatality rates among some key industries. It's not overall industries, just some key ones in there. So we are in the top 20 as of the most recent data, but this is an improvement from being in the top 10 the year before. So Kansas has improved, but there's still some room for us to grow. You can see here, I think we go back one more. Well, sorry. So looking at workplace fatalities by industry, you can see here that we have all of the US data going back over a decade in the blue and Kansas in the black. And then above those two lines, we have the top 3 industries with the highest fatality rates going back 10 years. So you can see there is an obvious gap between the orange line and the rest, and that is Kansas agriculture. And it has improved over time. You can see that drop, which is can be contributed to success stories that we're having in the fields and improved training and awareness, but there still is a gap between agriculture and the next highest one, which is transportation and utilities. And then the third highest one, going back over time and additionally in the most recent data, is Kansas construction industries. So looking at Kansas and the US only, we can see how I mentioned that Kansas has improved. You can see that gap has persisted over time, but you can see most recently it's really started to close, which is really promising to see, and we're making a lot of progress. The yellow line is the Healthy People 2030 goal, which is a goal that is set for the nation and states to meet. And both of the US and Kansas still remain above that goal, but I think there's potential to work towards that in the future. So similar to the graph we looked at before, the 2 graphs ago, the spaghetti graph. Here's another spaghetti graph. This one is looking at injuries and illnesses only. So the last one was fatalities, and now we're moving to injuries and illnesses. You can see here the industries are represented by the same colors. In this one, we have a new industry, which is Kansas Education and Health Services, which is the green line. So you can see Kansas and the US, these blue and black lines are a little bit closer than in the fatalities, but Kansas is still just right above it. So there's still that gap that remains. And similarly to the fatality rates, we see the orange line again, really improving over time, but the gap still remains between that and the next highest, which is education and health services, and Kansas trade, transportation, and utilities. So looking at where we are right now, this is the most recent data for occupational fatality rates in Kansas. These are the top 4 industries. So again, we can see agriculture compared to Kansas compared to the United States, the orange versus the gray bar. We have construction overall is right in the middle. And then we have manufacturing and educational and health services. So you can see again, the yellow line represents that goal of the Healthy People 2030 goal. And the orange is Kansas. So you can see amongst all of those, except for manufacturing, Kansas has a higher rate. Looking at injuries and illnesses, it's a similar pattern. Agriculture, again, is at the top, like we saw in the trend chart. These include the top 5 in Kansas, top 5 industries with the highest rates for illnesses and injuries. So we have agriculture, educational and health services, trade, transportation and utilities, manufacturing and construction. So there is some overlap. Some of the industries that appear for fatalities are also appearing in these high rates for injury and illnesses. All right, so next we're going to talk a little bit about how these fatalities are occurring. What is happening on the job that is leading to these fatalities. And so we're calling them events and exposures. And the most common cause of a fatality on the job is transportation incidents, which account for nearly 60%, which is more than half. So transportation incidents do not include like commuting to work. You have to be on the job. You could be moving equipment. You could be, driving while on the job, but it's not like your 30-minute commute from your house. And then the second highest leading cause is contact with an object or equipment. We'll talk about this a little bit more when we talk about agriculture as an industry, talking about machinery, which we see in construction and other industries that are high risk. So between the two of these, we reach about 75% of all fatalities are due to 2 types of causes. Okay, looking at who is at most risk in Kansas. First, we want to look at age group. So bear with me, this is a lot of graphs, I know, but I am a data analyst. The gray bars represent the percent of the workforce in 2023. So looking at all the workforce, we're looking at how many of them are in each age group. The orange bars represent the percent of occupational fatalities from 2011 to 2023. And the reason that we have to use that 10+ year period is the number of fatalities each year is quite low. So to get a better picture, we have to aggregate together. So you can see the percent of workforce really peaks with working age from 35 to 45 to 54, and then goes down as we reach older, 65 and older. But you'll see with the orange bars, there's a pattern that this is increasing with every age group that gets older. And one that really sticks out is that adults who are 65 years and older only make up about 7% of the workforce, but make up almost 20% of occupational fatalities, which is a stark difference. Next, looking at gender, we have the same gray and orange bars representing the percent of workforce and percent of occupational fatalities. Men and women make up a pretty even amount of the workforce in Kansas, but you can see with the orange bar that men make up almost 95% of occupational fatalities, which kind of tells us that men may be working in those high-risk industries more so than women. All right, looking at race and ethnicity, there's some disparities here as well. White Kansans made up about 86% of the workforce, but accounted for 96% of workplace fatalities. Black Kansans made up about 6% of the workforce and made up 2% of workplace fatalities. And then among Hispanic or Latino Kansans, They made up about 12% or 11.8% of the workforce and 14.5% of workplace fatalities. And that pattern among Hispanic and Latino fatalities versus the workforce is in line with what we've seen with national data as well. All right, so just some key takeaways before we move in to the panel. Occupational health, Kansas has made progress. You know, we've seen that gap start to close, but the gap still remains. So there's still work that we can be done, but we can also learn from the success that we have had. Data guides action. Looking at this data helps us understand who is most at risk and where they are, what industries they're working in, and allows us to have a place to start for targeted interventions. The last one is that occupational health is public health. It's an economic issue that affects families, communities, everyone who's tied to the workplace, which is the majority of us, and workplace safety affects all of us. It's not just an individual impact, it radiates throughout. We're now going to move into our panel discussion. So I'll ask our panelists to come up and join us here in a moment. And yeah, you guys can come up. So today we're going to be having Alan Vineyard. He's the Director of Industrial Safety and Health at the Kansas Department of Labor. Tawny Larson, who is the Program Manager at the Kansas Agriculture and Safety Program with K-State. And then Sarita Blankenship is the Member Services Manager at the Kansas Farm Bureau, leading health and safety programs. All right, thanks for joining us today. Yeah.
Thank you for having us.
So I didn't want to take away too much and introduce you guys too far, because I know about your work, but I want you to be able to also talk about your work in this field and your experience. So just one question to kind of kick us off, if you can introduce yourself and your role, and then what originally drew you to this field, or what kind of work you do today?
Sure, I can start. My name is Alan Vineyard. I'm the Director for Industrial Safety and Health within the Kansas Department of Labor. Got into safety about 30 years ago. Went to the University of Central Missouri, got a degree in safety management, and I've been doing this my whole career. I'm very passionate about it. I'm passionate about employee safety. And so, you know, this really has driven me to this stage. And you know, it's a big issue, and it's something we definitely need to take advantage of and promote as much as possible, just to get the awareness out there.
So I'm Tawny Larson, and I'm with Kansas State University, and I'm the program manager for the Kansas Agricultural and Safety Program, as well as the Kansas Agribility Program. And I guess where I got started originally was about 20 years ago. I started training service dogs in Oklahoma for people with disabilities. And my passion kind of has just been there ever since. I came to K-State and I started working on the Agribility Project. And that is a project sponsored by USDA NIFA that helps people that work in agriculture, farmers, ranchers, employees that have any type of limitations or disabilities. So we go out on the farm, meet with the farmer, find out what they can do, find out what they might need some help with, and recommend equipment. We work a lot with Kansas Vocational Rehabilitation Services to help fund a lot of that equipment. But then that kind of morphed into safety for us at K-State, because wow, we're seeing all these guys getting hurt out there. So what can we do to help inform them and help lower those numbers? You know, it's like working yourself out of a job with Agribility. Unfortunately, that's probably not going to happen because farmers farm their whole lives. And so even if they don't have a severe injury or illness, they still have needs that we can help with. So that's kind of where we're at K-State right now.
Hi, I'm Sarita Blankenship. I'm the Farm Safety Manager at Kansas Farm Bureau. I've been there for 25 years. I worked at K-State for 10 years in training and was looking around for other jobs, and Farm Bureau had a training position open. I thought, perfect. Well, when I went in, then that included safety. And so I've been involved, like I said, for the last 25 years, just working on farm safety, specifically with children. That was primarily my target audience. We've done lots of things with safety. I won't go into it all right now with the children, but yeah, that's where I came in. And I will say that my uncle was vice president of Farm Bureau in the 70s, and that made me, I had that connection and knew it was a good place to work and good people, and they're, yeah. So that's it.
Awesome. Yeah, well, we're definitely all very glad that you're in your positions now, and the work that you guys are doing is incredible. So thinking about the data, some of the data we looked at together, Kansas has had historically higher rates of workplace injuries and fatalities to those national averages. Question to all of you, what does the data tell us about some of those key vulnerabilities in the Kansas workplace right now? And I know some of those might be unique to the industries you all work in, but yeah.
Yeah, if I could go probably a little bit more into kind of the background of what we do. We are industrial safety and health within the Kansas Department of Labor. We have one group that is what we call our OSHA consultation group. They go out and do safety inspections. We sometimes call them mock OSHA walkthroughs of private businesses. We have to be requested in. We cannot just show up at a business. And we have other stipulations like, less than 250 on site and 500 corporate wide. And then we also have our public sector unit, which is responsible for employee safety with cities, counties, school districts, universities, et cetera. That is worked under KSA 44636, which allows us to just walk into any facility and do a safety walkthrough. We don't do that. We pre-plan these. We set up in ahead of time. And then we also have the amusement ride program. So, what's really kind of interesting to me is that, especially on the agricultural side, within our 21D program, we simply don't get the request from the agricultural side. We do a lot of manufacturing, we do a lot of construction, but we don't get that much from the agricultural side. And this is one of the things that we've been trying to figure out is, where is the disconnect? Why are we not hearing from the agricultural side? Because the data is there to show that they are having injuries, but yet they don't call us out. Everything we do is free. Our walkthroughs are free, our training is free, everything we do is free, but yet we can't get into that agricultural field, and we're trying to figure out why that is. So I think that's kind of our big push right now is finding out where is the disconnect between what we do and what's going on in the agricultural field.
Wow, I think Sarita and I can both attest to that. So a lot of farmers, we have 100,000 farmers in the state and 55,000 some farms. They often don't have enough employees to be under OSHA guidelines. So 11 or more employees would probably put them where they're under, following more OSHA guidelines. They are also, so you're not getting the report. So it's interesting to see how high the numbers are when we know that it's not capturing probably near half of what's out there. And farmers are very proud. They don't want to tell everyone or report to anyone they made a mistake and rolled their tractor, or they got hurt, or the chronic illnesses or something that's really hard to track when it's from chemical exposure or mold or those kinds of things. So what I find interesting in the data, and I've looked at this several times since you've sent it to us, is just the number that's reported. And I think, Alan, to your point, is even that I'm with K-State, not this state, there's still people are reluctant to have us come out. Some other state programs and safety programs across the country have tried to put together a safe farm program where we'll come out and we'll walk your farm with you and we'll help you identify some of the hazards. And it just did never fly because no one wants someone else to come in and tell them how to run their operation. And it's like that. It's probably going to be like that for years and years to come. A lot of these farms are very old. The buildings are old. They work just fine. And that's kind of the culture. And so what we can do and what we try to do with our program is help them learn the culture of safety. We found that if they're safe at home and on the farm, they're safer on the roadway too. And so if we can just remind them, I never go talk to a group of farmers and tell them what to do. I remind them of the things that are out there that they can use for safety, or maybe think twice or take a little bit longer to do something to keep them safe. So maybe along the same lines of what Alan might go in and do, but it's just a different atmosphere. It's a different organization coming in and working with them. So that might, I don't know how we could work together to convince them to let you in, but I'd love to do that.
So in many cases, farming and agriculture is generational. And like Tani said, farmers are proud. There's also a stigma attached to farm injuries or fatalities. I realize this because I have managed a farm safety database for years, and sometimes the only way I hear about it is if someone tells me directly that, because they know, maybe it's one of our interns who came from a different, county and says, we had a farm fatality, but it's not going to be in the papers. They passed away. Their family doesn't want anybody to know it was due to a farm incident. There's a stigma there. Weren't they good enough? What happened? So that's why we focused on children and to educate those between kindergarten and 18 or 21. They are still reachable. Farmers that have been doing this for years, that's exactly their mindset. Don't tell me how to do my job. I've been doing this for a very long time. I'm the third or fourth generation. We know what we're doing. So that's why we focused mainly on children, which I'll talk about later.
Yeah, and if I could just interject here. So, one with we talked a little bit, or the slide showed transportation, number one, and we would agree with that. Second was contact with equipment. And we see this when we go out west as well. We go into a shop and somebody's been running it for 50 years and they've taken all the guards off. And that's, I'm sure that's what we would see in these farms as well, is that, these machines are not guarded properly. These tractors do not have the PTO guards on them. They have no clue what lockout tagout is, and they go into these grain bins, not aware that they should be in a harness, they should be locked out. That's what we've got to get that message out to the small farms and say, hey, you're at risk as much as a big company is. And we can help you, kind of make these corrections, but it's up to them to come and say, hey, yeah, I want some help. For anybody on the panel to come to us and say, hey, what can you do to help us? That's what we're trying to do, is we're trying to get our message out there to let them know there is help and there's free help, and we can help them along. So, I think that's kind of the push today. It's really get the message out there that, there is help available. And you'll have to reach out to somebody, but it is available.
Awesome. So Sarita, I know you worked on a farm incident database with Kansas Farm Bureau. I was wondering if you could speak a little bit more about that, and if you guys noticed any specific risk factors or trends that were concerning, or anything that kind of stood out to you.
Yes, that's why I printed this out because I'm never going to remember all these statistics. But in fact, I should have looked at how many, but uh, about 10 years ago, we stopped tracking non-fatal incidents because it just wasn't reflective of what was really happening. At the end of the year, and we said, oh, we had 3 non-fatal incidents. That's not even close to what we really had. So we stopped tracking that about 10 years ago and just focus on farm fatalities. So looking back, from 2015 to 2019, there were 42 according to my records, total incidents. I don't report workplace incidents or roadway incidents. Those are reported by other folks. So I just do on the farm fatalities. In 2015, there were 10, 2016, 8, 2017, 10, 2018, 5, and 2019, there were 9. So total of 42 for that 5-year period. And then our numbers did decrease. And in 2020, there were 2, 2021, 6, 2022, 3, 2023, 1, 2024, 5. So there were 17 over 5 years versus 42. So, significant drop there. So far in 2025, we've had 6 farm fatalities. I was telling Tawny, some of these, you see something and in the obituary, it simply says unspecified farming incident. So I don't really know if it meets our criteria, but if their family says they passed away in a farm incident, then I'm gonna count that as a farm incident. So far this year, 6, and their ages are from 21 to 82. Okay, so that's what I mean with generational. I looked back since 1980, we've had this database. We have 2 1-year-olds in the database. Okay, 1 female, 1 male. 13 2-year-olds, 2 females, 11 males, 7 3-year-olds, 1 female, 6 males, 7 4-year-olds that were all male, 6 5-year-olds, 2 female, 4 male, 3 6-year-olds, 1 male, 2 males, 1 female, 6 7-year-olds, 5 males, 1 female. I'm almost done here, guys. 6 8-year-olds that were 3 females, 3 males, 3 9-year-olds that were all male, and 8 10-year-olds, of which 2 were females. So just looking at that, we've got a significantly smaller number of females than males. I'm not going to go into why that may be, but it is interesting data to know. And like I said earlier, they're generational. You have multiple members of the family working and living in the same space. And if there's not a dedicated play space that is actually used away from everything that's going on, you are going to have higher incidents. So at the top end of that, we have, and I told Tawny, I stopped counting, over 100 70-year-olds. Okay, 70, and 7 were females, so mostly men. We had 60 80-year-olds, 2 of which were female, and we had 5 in their 90s. 5 people in their 90s. The oldest person in my database was a 97-year-old male who was killed when the tractor he was mowing with rolled over. 97 years old, and he's one of 5 in that age group in the 90s. So the youngest was a 1-year-old male that was killed when he was run over by a grain wagon driven by a relative. And a 1-year-old female who was riding extra when she fell off the tractor and was run over by a brush hog. And if you know what that is, it's just terrible, terrible, terrible for everyone involved. I still remember the news article about her, her obituary. She just had the prettiest little hair and the prettiest little Easter hat on. And, it can happen to anybody that gets into that situation. So, I guess what I would say, and I mentioned this earlier, that farmers they know what lockout tagout is. They just don't use it because they've not used it before and they've been just fine. So it's things like that that they know, and that's why we focused on children. And I actually, we would do demonstrations, and I know Tani does some of those as well, but just different demonstrations with gravity flow wagons or power takeoff shafts, simulations, things like that. And I've had kids, extra riders. Oh my gosh, I've been driving across the state to go do a presentation, and I'll see not an ag kid, but a city kid with a big yard riding on someone's lap while they're mowing. And it's just, I almost want to pull over and say, do you know how dangerous that is? I know you love your child. Don't put them at risk like that. But sometimes when you're all in one place and maybe mom has to go work in town so she can get insurance, the kids are at maybe not in daycare, and they're at home and where they're comfortable. And so they are involved in incidents.
Yeah, that's really helpful. I think information like that really humanizes the data that we're able to get, from the Bureau of Labor Statistics. It paints a picture, but it doesn't tell us everything. When I look at those stats, for me, for example, my grandfather's 95 plus, and he's a farmer, and he's still out there all the time. So when I was looking through this data, immediately just the high proportion of male working in high risk industries, and then that age group immediately. And I know many Kansans have connections to family members or friends who work in agriculture or farming. So I think that just really helps kind of describe what's happening.
Just real quick, my grandmother taught school full time in Cali County, and she farmed full time. And she quit farming 2 weeks before she passed away because she was admitted to the hospital. That's the only reason she quit.
If I can just add to, maybe people don't realize this, but of course, agriculture is one of the largest industries in the state, but also it's an industry. There's not other industries where children live and grow up and catch the school bus and run around and play. And it's an awesome experience as a kid to grow up on a farm. And I want to be really clear that we think that's great. We want kids on the farm. We want to promote agriculture and family farms and all of that. But it is dangerous. And so, what Sarita explained, the age range is amazing there. And so if you think about, you have 2-year-olds running around and you have 90-year-olds running around. And during harvest and planting, I always see on social media, the kids in the cab with the parents. And that people have just grown up, and they will tell you this is what they did with their parents and their grandparents. Sometimes it's not the best idea to be on the fender of a tractor, and it's better to break that tradition than the consequences that we could have. But on the other hand, the 90-year-old, that's what he wants to do. That's all he wants to do. And you see on social media where, okay, we got dad on the tractor, we got dad in the combine so that he could sit there with us for a couple hours. And that, that's what he's living for. And so we have to embrace that too when we talk about this, and when we go out. And usually it's a family event. There might be 1 or 2 guys that farm most of the time, but during harvest it is family. It is taking meals out there so that they can get the harvest done, get the planting done, because it's all associated with the weather and what's happening. So they're just the most dedicated group of people I've ever met. And there's the agrarian way of, this is what they're going to do. And I work with farmers with disabilities, and, I have a guy that was hurt last year during harvest. And he lost his leg, got pretty high. And he had somebody finish harvest. There's a group called Farm Rescue that will come around, and they're all volunteer. They travel this region and they'll go do planting and come in at a time like this in crisis. And he called me so I got that call the week it happened. And I was like, okay, we want to help, but he needs to get through some surgeries and some rehab. And then they called me in the spring, and it was like, okay, we're ready for you to come out and see us. Oh, but we already had somebody get him up in the tractor so that he could plant. We've had a friend build a lift so he could get into the combines. We've done this and this and this already. And so one thing about I mean, farmers is they're going to get out there and they're going to do it. And we want to make sure they do it safely. And that's where like agribility can come in and help. But at the same time, my point is just they're going to do it. And like the guy now, he's done his harvest and he has his lifts that his friends built for his tractor. We're still going to help him with some other equipment. But I don't think there was ever a thought in his mind that he wasn't going to go farm again. And he was even surprised to hear that there's other farmers out there like him that have had a leg amputated that are still farming. And so I think that just kind of the point is they're going to farm no matter what. So let's help them do it safely.
I have a quick story about farm rescue that they reached out to me about 5 years ago, and they were looking to do a surprise reveal at a big sporting event for a farmer that needed equipment retrofitted for injuries. And they asked me, since we have contact with 105 counties, could I reach out and find some applicants that would, benefit from this program? I tried and tried and tried to get anybody to apply. No one would. There are absolutely people around the state that could have used their help. They're too proud. They just weren't, we'll do it ourselves. That's our way. And I just thought I'd throw that out about that farm rescue. I never did find anybody that they could help. So
One of the things I'd like to hit on in the discussion here, and also with the data we looked at, males are a very high percentage of workplace fatalities. We currently are working with some groups out of Wichita, the Wichita AGC, and some other people on suicides in construction. This is a big issue. In construction, it's a male-dominated industry. And, one of the things we've been trying to tell these young men, a lot of them, is you've got to get rid of that stigma that you can't ask your fellow coworker, how are you doing? You've got to be able to do that. And so we see a lot of that where, construction and agriculture, very male-dominated industries, and a lot of proud people. But, we're really trying to get over that and say, look, if your buddy comes in and he's not looking right or he's messing up, you really need to step aside and say, hey, how are you doing today? I know you're going through, a divorce or whatever, and really reach out to that person, because suicides in construction is a very big deal. OSHA is really looking hard at it. We are looking hard at it. We're working with OSHA. We're working with, I can't remember all the groups we're working with. But, we put together a presentation and a video for suicide prevention in construction. I believe it's on the Wichita AGC site. And we're really trying to reach those people that this affects. So again, I think we're kind of what we're talking about here is a lot of, again, proud males that don't want to reach out to somebody for help on their safety. And again, on construction, reaching out and talking to somebody about suicide. I mean, it's not an enjoyable topic, but it's one we've really got to reach out and embrace and say, yes, it's happening. Why is it happening? What can we do to get it corrected? So.
Oh, awesome.
I just want to take the opportunity to thank you for mentioning suicide prevention. And we know it's big in ag too, unfortunately. We lose a lot of ag workers, and it's a huge impact on the communities. And K-State, Farm Bureau, I know we both have programs, and I know that's not really our subject today, but I just want to take the opportunity to say anybody can reach out to either one of us. We can connect you throughout the state or region so that we can get resources out there to the communities.
Yeah, definitely. I think one of our objectives today for the audience and people who will record this for any folks is knowing that there are resources out there and where to find them, and increase the awareness. I know, Alan, you've mentioned that you've talked to folks who are like, wow, I wish I definitely would have used your service if I would have known about it, but I didn't know about it. So putting out those resources, I think, is really helpful. And just a reminder, some of them are on your resource guide, so you'll have them with you when you take that home later.
Yeah, that's definitely a frustrating part for myself and for my staff is when we go out somewhere and you know, first time we've visited a place and they say, oh my gosh, why didn't I know about you guys 5 years ago or 10 years ago or last year? And it's like, yes, we're here. We're trying to get our message out, trying to let people know who we are, what we do. But yeah, to hear somebody say, oh, you know, I just paid, you know, $50,000 in OSHA fines that you guys could have helped me, you know, alleviate. And it's like, yeah, you know, we know, you know, we're out here, we're, you know, trying to get our message out there. We do probably, we do about 300 private business consultations in a year. I have consultants all across the state of Kansas. We do about 300 public sector a year, and then we do about 100 amusement ride audits in a year as well. So we're out there, we're busy, but you know, we can always squeeze in more people. So
yeah. So one thing I want to move towards is you know, what's working? What are some success stories that you guys have? Whether it's partnerships or innovations, what's giving you hope right now?
a couple of things are giving me hope. One is that we just had our 75th anniversary for the Safety and Health Conference for the state of Kansas. Started in 1950. We just finished up kind of our attendance registration, and we had 225 attendees, and almost half of those, it was their first year coming to the conference. So that's awesome. You know, because we know there's you know, there's a shift, there's people retiring, we're getting younger kids, and to see them coming to the conference for the first time is absolutely amazing. That's what we want to do. We want to make sure that we capture them early and you know, get them involved. The other thing we have is what's called SHARP, Safety and Health Achievement Recognition Program. It's run through the OSHA office. Right now we have, I believe it's 147 SHARP sites across the state of Kansas. We are #1 in the nation. SHARP is the best of the best. You really have to have your safety and health program in place to be SHARP. So having that many people in SHARP is amazing. We do have a company, Flame Engineering out of La Crosse, has been in SHARP for, gosh, 25 years, I believe it is now. So, you know, it's companies like that that we're looking to and saying, it can be done. They've done it. You can do it too. Now, the main thing is with our SHARP companies, we know that they get buy-in from the top all the way down. And that's what's key. We tell people all the time. We had a panel discussion at the Safety and Health Conference, and one of the things that I mentioned was you've got to get upper management buy-in. That's where it starts. And we're seeing that. So, you know, we're seeing a lot of upper management buy-in. We're seeing a lot of young kids, a lot of new people taking over in the safety field. And to me, that's what gives me optimism.
So for me, I think being optimistic about the opportunities that we have to, I'm with Sarita. I love to work with youth. And so I think informing youth about ag safety. I just did the Kansas Teen Transportation Conference yesterday, and it was enlightening to me, and I think to them as well, things that they had not thought about when encountering large equipment on the roadway and that type of thing, because transportation, one of the higher fatality rates that we have, and a lot of it is associated with ag equipment. We have a study right now in process looking at all the KDOT crash reports that involve ag equipment throughout Kansas and identifying what roadways we're seeing those accidents on, and working with some KDOT people as well to identify areas that maybe there needs to be different signage, we're going to go out and actually look at those sites. Is there a big tree in the way? Is there, what's happening? Why are these accidents happening? So research dollars aren't as plentiful as they used to be, but with our program getting going and getting some research ideas and some different partners out there, there's just a plethora of things that we could look at. And I'm really interested in the KDOT success that we're going to have, because I think it's going to make a big difference. And then just the continuity. And I think the continued message, and people continue to see us out doing outreach like this with teen conferences, any opportunity that I ever have, I'm always happy to share. And same with, I can always, I can talk a little bit about agribility, a little bit about safety. It all kind of goes together. So I just think being consistent and being in front of people as much as possible.
Okay, so I'm involved in a couple of safety initiatives on the national level. One of them is the FAST program that was created by the American Farm Bureau, and it kicked off in 2017. It was actually piloted here in Kansas at 3 locations and in North Carolina in 3 locations. It consists of 10 modules, and I'll just briefly go through them. Attention and distractions with ATVs and UTVs, spatial awareness with livestock, critical thinking with tractor and equipment safety, breakdown and job safety analysis with personal protective equipment, task skill match, in other words, making sure that the skills match the tasks that someone is asked to do, decision making with manual labor, situational management with bins, silos, and pits, empowerment with chemicals and pesticides, tough conversations with slips, trips, and falls, and impact of injuries with shop safety. And just by reading those titles, you can hear that all of the things that people involved in agriculture are dealing with. It's not just a couple of things, it's a wide variety of things. So that's actually, it's on their website. It's free for anyone to use to pull out the resources. So just look up FAST program, FAST, and you'll find it on American Farm Bureau's website. There are 2 Ag Safety Awareness Weeks celebrated nationally. The one coming up this fall is the I'm not sure I'm going to remember the exact name of the national ag safety folks, but they have a week coming up here soon. The one I'm involved with is called ASAP Week, Ag Safety Awareness Program. It'll be March 2nd through the 26th. We've been doing this for about 15 years. Every year there's a different theme, and every day of the week there's a different theme related to the overall theme. So the theme for 2026 is Live Well, Farm Well, because we realize that, if you're living well, you're going to farm well as well. Monday is called Beat the Heat. Tuesday is Rest and Refuel. Wednesday, Know Your Numbers. Thursday, Safe Lifting. And Friday, Move with Purpose. In the past, we've done a lot of things related to something everyone can relate to. This year, we're really focusing on ag producers and farmers and ranchers. So that's why it's specific to them. Know your numbers. How many of them know their numbers? Are you resting? Well, when you've got weather coming and you've got to get crops out, you're probably not resting. Just focusing on taking better care of themselves. And the last thing I want to mention is that prior to COVID, part of my job was to travel the state, and I've been to I don't know how many kids ag days and done presentations, but that all kind of cut off with COVID. So what I did was took all of the programs that I did and I turned them into what we call do-it-yourself programs, and they're all out on our website. And we have 105 association Farm Bureau counties that have associations in them. Their folks often go out. Other folks on any of our leadership teams can go out and do these programs. anybody can access them on our website. So I think that has helped. Like we said, we talk a lot to the youth, and there have been plenty of instances where there was one day, it was in Potawatomi County, and I was at a Kids Ag Day, and we were talking about extra riders, and I do get a little graphic with them, depending on the age group, how graphic I get, but talking about riding extra and falling off and getting run over by one of your relatives. It's heartbreaking for everyone, especially the person that was operating the vehicle. And one of the little girls said, I'm going to tell my grandpa I can't ride on the tractor anymore. And I thought, that's, you can when you're old enough to operate it yourself. But before that, please don't, because you just never know. Even in an enclosed cab, I used to do a program called 911 Days in Dickinson County. And what they would do is they'd have firefighters and EMTs and farm safety and different stations like that. And there was a horrible accident. There was I believe she was 7 years old. She was not buckled in the cab. There was a cab, and she was jumping around and kind of hit the windshield, and it broke out, and she fell. And some of you may remember this incident, but when I was talking to some of the first aid folks there that day, he told me that incident ruined 5 careers. He said, some of the folks that went out and had to clean up, one of the guys had a daughter that was the same age. I mean, it just impacts way more than just the families. It affects your first responders and your law enforcement and anybody else that has to be involved in that. So anyway, that's why we work so hard to try to get the message out and just totally avoid situations like that. Even if it's going against tradition. We had a pretty successful campaign once that it was it's easier to bury a tradition than it is a child. And the picture was a man in a tractor with a grandchild on his lap. And some people were offended, but I'm like, this is spot on. It is much easier to bury that tradition than it is that child.
Thinking about, looking forward and using what we've learned from some of those success stories. I'm wondering, we talked about that kind of tough it out mentality and, not letting folks know. And there's an incident, and thinking about agriculture, but also we saw in the data, health services, and we have folks online who work in healthcare across the board. How can we better engage workers and themselves in these safety conversations and help kind of break that stigma?
Yeah, it's all about, trying to get the word out there and letting people know that it's okay to be part of the safety system wherever you're working. And definitely in healthcare, that's another realm that we've kind of dropped the ball on a little bit. You know, between ourselves and OSHA, we're really struggling with, what do we do with the healthcare industry? And it really became, very forefront during the COVID situation. And how do we protect healthcare workers when something like that is going on? And I think it's something we're still kind of looking at and trying to figure out, how do we reach, certain hospitals, and we have everything from, county hospitals to, St. Francis, Stormont Vale. And again, they all need to follow workplace safety rules. And again, we're just kind of struggling to reach that industry. We do have a couple of healthcare groups in Northeast Kansas that are part of our SHARP program. They do an excellent job, so we know it can be done. Again, it's just reaching some of these smaller hospitals and trying to get the word out to them.
So we partner with Central States it's CS Cash, it's Central States Center for Ag Safety and Health at the University of Nebraska Medical Center. And they're absolutely amazing program. And they're funded by NIOSH, which is under CDC. Funding is questionable at this point, like going forward after the next year, which unfortunately, I mean, I hope we can keep it going. They put on a program for physicians. It's a continuing education program. So I know there's some classes up there in Masters of Public Health, and anyone else that's interested. I've attended their classes where they have professors and researchers that come in, even, you know, the ER docs and the trauma surgeons that come in and talk about different things that doctors are going to see in their clinics, or, you know, it could be a nursing program as well. And that's where I think we can work with healthcare to inform them more about what to look for. You know, when the guy walks in and he's like, it depends on the time of year, I think, but most farmers aren't going to go to the doctor unless they really have to. And so if it is, you know, they have a horrible cough that they just can't get rid of, well, let's dig a little bit deeper and think about, what have you been doing? What have you been out harvesting? Have you been working in grain bins, cleaning out some things, and really educate our healthcare workers so that they can understand what this occupation is doing that is so important to our state. And that's something that Central States does a great job at. And I would love to see us have something in Kansas that's similar, maybe through one of the med schools or centers here, where there can be a lot more outreach to at least offer some information out to the rural healthcare workers. And you know, we hear about hospitals closing as well, and that's going to have a huge impact. That's going to keep people from going to the doctor even more, because they can't take an hour out of their day just to travel to go to the doctor. It's the same thing when we talk about mental health, but they're not getting to those clinics. And so telehealth is great, but it's not the end all be all, I think, for some of these guys that really need to be seen. So I think there's some jokes around not mental health, but like just healthcare workers in general, that if a farmer comes in, then you pay attention because he's really got something wrong. So I really think we can do a lot better, and hopefully we can work on that together.
Great. Sounds good. So just kind of, we've got about 10 more minutes. And before we jump into our last question, I just want to check if we have any questions online or from the room. Otherwise, we'll keep chugging along. All right. So for participants that are here with us today in person and online, you know, they're coming from lots of different industries, but in your guys' perspective and with your experience, what's one step or a quick win that they could take away from today to move the needle on workplace safety in Kansas?
You know, I think it's awareness. I think that's where it starts. You know, there are steps that people can take that don't cost anything. You know, maybe it's reaching out to a group like ours and just having us come out and do a quick walkthrough of their facility. You know, doing some research themselves, trying to find out, you know, what are the big issues in my industry. I mean, the data's out there. It's just a matter of either finding it yourself or asking the right person where it is. The information's out there. You know, we you know, code everything by the NACS code. You know, it used to be the SIC code. You know, we know the numbers for every industry in the state of Kansas. We can get you that information and tell you, you know, oh, well, you know, these are how many injuries that this industry is seeing, how many fatalities, all of that. You know, that information's out there. And I think that's where it kind of starts, is just becoming aware of what's out there, the information, and trying to kind of guide yourself to just get started. I mean, that's the main thing, is just take that first step. And you know, the rest of it will follow.
So I think about the average age of a farmer in Kansas is 58.2 years old. That's average. So, and that's probably most of our farmers. Only, I think it's 9% are 35 years of age. And there's a huge gap there. And so when you think about by the time you're 58, your body starts to break down a little bit. There's a lot of musculoskeletal issues. That's kind of the number one thing that we hear people are concerned about. So really taking care of our bodies, stop jumping off of tractors, stop jumping off of tailgates and that kind of thing when you're young. I always tell kids, like, grandpa isn't hard of hearing because he was born that way necessarily. It's probably because he's been around all this loud equipment his whole life and didn't think about wearing ear protection. So really thinking about all the tools that are out there. I mean, simple PPE to just protect when working with chemicals, when working with sprayers and around dust, and just really, I think something that you probably think everybody should do, and I agree, but I think not as many people do it. And don't reuse that dust mask for years. Like, get a new one. So, but that's what we see. I mean, you see in a shop, you see an old dust mask hanging there, and it's just like, hello, let's get a new pack. So I think that's kind of what I want to send out. Is there's stuff that's out there to make things safer and make your body safer, make your work safer. It's just a matter of taking some little steps. They're not expensive. And then also taking your time. And something that happens with people working in ag is they wake up and they might have a plan and they get a flat. It sets them back hours. And so they're in a hurry. And I think that's when people have a tendency to get hurt. It's not when you're, mindful. I think we all do that, right? Like, if you're not paying attention and you're running late, you're stressed, that's when accidents can happen. And so really taking our time. And I had a lady tell me at a presentation I gave not too long ago, she said, the older I get, the slower I move and the slower I think. And I'm like, bingo, and when you're thinking about 58, you're heading into 60, some people are thinking about retirement. And our farmers that's the average. So we have to take that into, I think, perspective too.
Well, and I think just being honest with themselves about what is dangerous and what they can do to avoid that danger. Sometimes it's just like we've talked about this whole time. They're so busy. They're set in their ways. They know what they're doing. I remember somebody asked me, and it was actually here in Topeka, to come to a meeting and talk about farm safety to adults. But she said, I don't want you to make them cry. And I said, well, then you don't want me, because that's the reality. It's sad. It's terrible. I remember, gosh, this was a couple of years ago, and I actually live in Pottawatomie County, and I scour Google and such for farm fatalities, and one came up, and it was Pottawatomie County, and it was like May, and we hadn't had any fatalities yet. And I started tearing up, and I thought, oh my gosh. Well, it turns out it was Pottawatomie County, Iowa or somewhere. And so I'm like, oh my gosh, it's not us, but it's like I said, it's devastating to so many other folks besides just the nuclear family that it happened to. And doctors and nurses, when people go in with these injuries, if they're still alive, it's just being honest with themselves and about what can happen, and that they know they can help prevent it.
Yeah. With our last couple of minutes, I just want to make sure. Oh, we have a question online.
This is actually from me, not the chat. I am part of KHI. I am a city person, to say the least. I'm so far removed from the things that are going on in the western part of our state. But so what are some implications on a workplace in manufacturing or agriculture if issues caught by OSHA are found? And do they prevent some of this people from having conversations if something did happen, such as an accident?
I'm not sure I understand the question, but so are you asking? Yeah, go ahead.
Oh, I mean, like, can people get reprimanded? Like you said that there's fines if there's something is caught on site. Is that pretty frequent?
Yeah, it is. I mean, if you want to get into a discussion about OSHA, they have, again, inspectors all across the state of Kansas. Right now, and of course, as soon as I say something, I'll be called out. But there are emphasis industries that they're looking for usually first. They do a lot of complaints. They do a lot of reported, hazards in a workplace. So, the hazard, the fines are steep. And if you get into repeats and, they come out a second time and it starts really mounting up from there. Is it a deterrent? It depends on probably who you talk to. There are probably some larger businesses that just write a check and, they go on their way. But they definitely, the fines definitely hit a lot of the smaller businesses where it hurts. And so, understanding that process, again, it's, to let the small business owner know that there is a process, that they do have rights. They don't have to just take what OSHA tells them and that's the end of it. There are certain rights they have. They can do informal conferences. A lot of times they can get fines reduced by showing good faith effort, by trying to get corrections done while the inspector is there. So yeah, there are lots of ways that they can get kind of those things reduced. But again, they have to know what their rights are. And a lot of times these small businesses simply don't know what their rights are. And that's one of the things we explain to them when we come out is, here are your rights if OSHA shows up at your door. And kind of walk them through that process just so they have that knowledge.
Awesome. Well, I want to provide you guys each to be able to plug in your resources, because I know that's something we really want our audience to be able to take away today. So if you'd like, I'd like to give you guys each minute or 30 seconds just to, let people know where they can find your resources, how to contact you if they have questions or are interested in partnering.
Sure. Our information is there's a QR code on the paperwork. We can be found in the Kansas Department of Labor's website under Industrial Safety and Health. You can go there. You can request a free consultation on the private side. You can also do that on the public side. You can look at what training we provide. You can get a hold of us. 785-296-4386 is our main number. And that gets you to our private side, our public side, and our amusement ride. And again, we have training available. You can see what training we have and get a hold of our trainer. I think his email address is on there, and kind of start working on a schedule to have him come out. So yeah, I mean, that's where all of our resources are. KDOL, KDOL's website, and then you can find us under Safety and Health.
So we also have the QR code on here for our website. We go by KASH, KASH, Kansas Ag Safety and Health. And we're also part of the College of Engineering at K-State in the Biological and Agricultural Engineering Department, which may sound odd to some, but it makes sense because, years ago, engineers did some things to tractors, and modifications and that kind of thing. So safety's just always been a really important part of our department. We also work with other colleges and departments at K-State. Also, the Agribility program is also, we have a website on, I don't know if it's listed here, but it is linked to on the KASH site. And then I also want to give a plug to the College of Agriculture in the Ag Education Department has a certificate program for agriculture and occupational safety and health. And I'm actually taking classes through that program now. It's awesome. It's taught by Mitch Ricketts, and he is well known in Oklahoma and Kansas as an instructor and an expert in agriculture and occupational safety. So great program. Anybody can take it. I think it's like 12 hours to get the certificate. And, you know, I've learned a lot from him, even though I feel like I know a lot about the agriculture side of things. You know, we just had electrical this week, and I don't know much about electrical, so I'm learning. So I think there's always that room to learn and grow. I know on our website we have articles that have been published. We do a lot on the Agriculture Today radio. It's a podcast, or it's also out every day on radio stations, and we do interviews on different topics depending on what's happening out in the field. So we like to talk about, you know, if it's planting season or whatever's going on. We try to be very up to date on what's happening and also share our research. So I think that helps. We have different people, and Dr. Ed Brokish is also in our department, and he does some of those shows too. So we're always happy to come out and talk with anybody. I'm happy to hop on a Zoom if anybody wants more information or put together something more formal. So thanks.
There is a QR code linked to our farm fatality page that has just data from 2020 to current. I actually have an access database, old school, but it's the best I can find for this purpose, that has tracked farm incidents in Kansas for since 1980. So I can sort by county, I can sort by our districts. We have 10 districts in the state. I could sort by age, I could sort by gender, all sorts of things. I will say that the information on our website does not include names. It's a number that refers back to that access database. But if anybody would like specific information, maybe on equipment injury or fatality, or grain fatalities, or like I said, different ages, I can certainly help you. Just reach out and I'm happy to help. Our DIY programs are on kfb.org. Click on education, and then safety comes right up, and safety DIY programs are right there. So the FAST program that I mentioned earlier is on the American Farm Bureau's website. The quickest way I can find to get to it is to Google it. So,
Yeah, perfect.
yeah, we're
Well,
happy to help. If anybody needs anything, any information as well, just reach out to me. I'm happy to help.
awesome. Well, thank you so much for spending time with us today, and we really want to thank you for all your expertise and joining us in this conversation. Thank Rebecca to close us out, and I'll let the panelists get back to their seats.
Thank you so much for such a wonderful conversation, really informative, impactful, and meaningful. And as was mentioned just a little bit ago, that resource guide is in the chat once more. If you're in the room, it's on the table. We do have extras. Please feel free to take them and also share those with your colleagues and other folks who might be interested. In about a week, this along with today's slides and the recording will be available. So again, we encourage you to check that out and share it with others who you think might benefit from this information. Along with that, we do have a lot of other information on our website, so please feel free to check out other upcoming events and other topic areas, other reports that have been written. If you're joining us here in the building, we do have some of those printed out in the back, so feel free to stop by and grab some on your way out. Thank you so much for joining us today. We really appreciate your time and engagement. We hope you have a wonderful day. Thank you.